So I'm reading my monthly copies I do every month of JAMA Network Open, the Journal of the American Medical Association.
Of course.
And
yes.
I come across this story that says, and how about this for a headline? More than half of people, 56%, who are infected with the Omicron variant are not aware of their infection.
Somehow I'm not surprised. You are?
No, I'm actually not. But
Yeah.
I mean, to see the number actually there, it's like we've heard anecdotally. Someone said, well, I thought I was sick, but I didn't think it was this. They don't bother testing. And it turns out that when they are tested, as you're about to hear, they do have it. So Dr. Susan CHENG is director of the Institute for Research on Healthy Aging at Cedars-Sinai. And on the line with us right now, Dr. CHENG, first of all, thanks for being here.
Well, thank you so much for having me.
Can you give us an idea of, because it does seem like it's a large number, though at the same time we're not that surprised. So how did you determine these findings?
That's a great question. So first, it seems like a large number of people being unaware. We actually know that there have been studies in the past, early during the pandemic, suggesting the number might even be as high as 80%. That's pre-Omicron, so not even the stealth virus variant that we're dealing with right now. But knowing that and going into the Omicron surge, we realized there was an opportunity to try to measure what was really going on by measuring people's antibody levels. Really two antibody levels. One antibody level looks at the response to vaccines. It tells us if their immune system is responding in a robust way to each dose of vaccine. And the other tells us if the immune system has actually seen the virus itself. And so that second antibody level we saw actually start to go up in more and more people as the Omicron surge started last winter and then took off. And because we had study participants very engaged, filling out health surveys and telling us how they were doing, we were able to track and actually measure pretty specifically how many of these individuals who had the antibody levels go up in response to the natural virus itself, how many of them actually seemed to be aware that anything had happened. And it turned out, as you see in the article, majority, more than 1 out of 2 people in whom that antibody level went up, telling us their immune system did respond to the actual virus, they didn't know it. They mostly didn't have symptoms, and when they did have symptoms, like 10% had some symptoms. They thought it was, the common cold or something else like allergies.
Is this a good thing in terms of the evolution of the disease? I mean, I assume it's better to know that people have it, but if they had it and didn't know it because it was so mild, what does that tell us about where we're at? Yeah,
that's a great question. It's good and bad. In many ways, of course, we're glad that we're at a place right now in the pandemic when the virus is really not doing a whole lot of harm for most people. Now, that being said, there's still an important subset of the population in whom Omicron is still causing severe illness or even death. And those are, of course, the people we care about. As clinicians, we care about them because we see them as patients in the clinic. They're immunocompromised. They have conditions that put them in a more vulnerable state. And so for the rest of us who may not have those immunocompromising conditions, I think we're all in a state right now where we realize if I do get Omicron or I get it again, because people are getting reinfected with Omicron, it could cause mild symptoms. But now I realize it can actually cause no symptoms at all. I have to be really careful and thoughtful if I have been exposed. I'm now at a point where I'm thinking if I've been exposed or if there's any possibility I'm coming down with something, I feel a little off, I'm going to be more thoughtful, not only because it's important for my own health, but because it's important potentially for the health of others.
So the takeaway here, which is it's great to know that the symptoms are not severe or perhaps not even there at all, but then it does pose a problem, does it not, with respect to people not knowing that they have this who can then infect others?
Exactly. So my approach and the approach that we're taking right now, given these data, which are really in accordance with what we've seen from other studies, is if I've been at a social gathering or I've been in an environment where I think I've been exposed or I know I've been exposed, I'm going to lay low. I'm going to watch my own symptoms. I'm going to be thoughtful about where I go, who I interact with. I'm going to wear a good quality mask if I can. I'm also going to take care of my own health. I'm going to think about my own health a little bit extra during that period of time, during those next few days. I'm going to test if I have access to testing, not just once, but ideally twice, at least a few days after the possible exposure. And in terms of, again, taking care of my own health, I'm going to probably try to get a little extra rest, a little extra sleep. Sleep equals immunity. That's another saying we have. And just try to be extra careful and thoughtful about not just myself as somebody who wants to stay healthy, but how my own health actually potentially can affect others.
Dr. Cheng, what does this tell us about vaccination? Because I think some people hearing this are going to then think, well, it's so mild, I don't need to bother getting vaccinated. So where do we stand on that?
Yeah, that's a great question. We actually just published a different study in another journal. This was a few weeks ago in the journal Hypertension, showing that in our health system, of all the people who were infected with Omicron during this most recent surge, still 10 to 15% had Omicron illness severe enough to land them in the hospital. And so when we look back at those data, it looked like actually almost all of them still actually had been fully vaccinated, not just that they'd had a booster. So after three doses of vaccine, there's a substantial proportion of people who can get Omicron, and when they do get Omicron, still get sick enough that they need to go to the hospital. So we have a hard time right now still predicting exactly who those people are. So no one is really, unfortunately, safe from being more severely infected. So the more vaccine doses, the better. But even if we are fully boosted, there's still that chance of getting really sick.
Yeah, which I guess would give you an idea of why the uptake on the vaccine has kind of slowed to a trickle, right? People hear this, they talk to friends who say, well, I had it, but it was really nothing more than a cold, which makes it harder for, people like you who say, look, you should still, certainly if you're immunocompromised, but if you don't want to give it to someone else, you should still consider getting your vaccine and clearly getting your booster. I don't know how you get over that hurdle.
It's a tough one. It's a tough one for sure. I think it's a challenge for us. Going through this pandemic, we're really trying to help people, patients, individuals, communities at large, try to think about this situation not being just about their own health. And when we do run situations where the focus is on the individual person, we say, there's still a chance, and we do see this, that you could develop long COVID after even just a mild case of Omicron. So there's that chance with respect to the individual level situation. But, at the end of the day, we live in society and a community of relationships and networks. And whether it's a family member, a household contact, a coworker, or somebody at the grocery store, there is still the chance, and our data suggests and indicate there's a pretty high chance that if you are walking around with the virus, even if your own symptoms are fairly mild, there is a chance you could pass it on to somebody else who's in whom the effects of the virus are much worse.
Yeah,
and so we're hoping that the message gets out, that people can continue to start thinking not just about their own health, but also about the health of the people around them.
Just as a final question, should people now hearing this thinking, oh, maybe that was me, maybe I had it and I didn't know, is there some way to, I was going to say, if you go back and try to understand or figure out if you had it or not?
Yeah, that's a great question. In our study, we offer, as part of the research protocol, these two types of antibody measures that can help distinguish between the immune response to vaccine, which most people have had by now, versus the natural infection. That type of antibody testing is not easily available outside of a research study, so it's not a readily available opportunity. And the other issue that is a little complicating factor is that antibody levels do go down over time, and so it's not a foolproof way, even if you enter the research study and get that particular antibody level tested, to know if you may have had the COVID infection many months ago or even last year. But we hope one day there is some sort of an assay or a measure that helps people know what their prior exposures have been and where they're hopefully moving forward.
Yeah, that'd be great.
So here where we are in the province of Quebec, the government just mandated a fifth booster. So this would be, I guess, your third booster, but your fifth shot overall for people starting at 80 plus and then 75 plus. Is this still in your consideration, this 5-month window between shots, regardless of whether you had COVID or not, still the way to go?
All the data would point in that direction. So yes, it sounds like in different, and we've seen this, different governments and different parts of the world will, depending on the numbers they see in their locale and their region, will make decisions that hopefully are the best for those communities. But all the data in aggregate would seem to point to the more number of exposures, the better. So the more boosters, the better. And if between booster doses somebody has developed infection, that in effect is a form of booster. So the number of exposures, whether it be vaccine or infection, is hopefully the way that we are all going to make it out of this pandemic, while hopefully minimizing the harm.
Dr. Susan Cheng, Director of the Institute for Research on Healthy Aging at Cedars-Sinai. Thanks so much for the time this afternoon. Much appreciated.
Thank you.